Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. And if you follow us, you know that I do cosmetic facial surgery in Richmond, Virginia. I only do surgery from here to here, and I don't do boobs, bellies, and butts. Why is he holding a device, you may ask? Well, that's what this video is going to be about. So probably my favorite procedure is facelift surgery, and I think this month we have 13 facelifts. We do about 100 a year, and I've done, by the time of this video, about 1,300 lifts. So I love doing facelift surgery, and I've got a lot of videos about facelift surgery and a lot about recovery. So this is really just a short little video, and when you have a face and neck lift, okay, the skin is separated from the deeper tissue. And just as a natural process of healing, you're going to have some bleeding in there and some tissue fluid and some swelling. And it really helps your healing to keep your head up during your immediate recovery, okay? If you keep your head down, what happens is it makes these little rolls of excess skin, because when we bend our head down, and in the immediate post-operative time, blood and serum and edema can kind of organize in these rolls, and what happens is you get little bands of swelling and fibrous tissue, and these things can persist sometimes for several months, and it can detract from your facelift. So one of the main offenders that I have come to realize are devices, right? Because, you know, everybody is going to be on their phone or their tablet or their computer, and they're looking down like this, okay? So after your lift, it's very important that if you use a device, you want to keep your head up. And I know that sounds real trivial, but any doctor that does a lot of facelifts will understand this, because every once in a while we see a patient come back, you know, in the early time after facelift, and they have these bands about as thick as my finger that go across their neck, and we have to do ultrasound or steroid injections or something to manage these. So you want to prevent these, don't look down at your devices. Plus it makes us look older, right? What looks worse than looking at your phone under your skin? What can you do to keep your chin up? Well, some people will use airline pillows or similar devices, and you have to figure out, is it better putting it on frontwards or backwards? Which way keeps your chin up the best? And you know, it kind of depends on the device, and you also want to make sure you're not putting any pressure, so you don't want to use anything that's going to push hard on that undermined flap or any suture line, so you want to run it by your doctor. Also, you could just take a towel and wrap it around your neck, you know, roll it up and wrap it around your neck and put a piece of tape, and that will keep your chin up. And it's just that some people, you know, they naturally will rest in a position like this, or they will look down at their devices, as we discussed. So probably the best thing you can do is to have your caregiver and your family members keep an eye out. So if they see you doing this, they're going to remind you to keep your chin up. And it's really important in that first couple days after surgery, or first 2 weeks, really. And again, this doesn't happen to everybody, but when it happens, it's a pain, and it slows down your recovery. The easiest way to not get them is to stay out of that posture. Keep your chin up.